My name is Rajeev Mudumba, and I'm the CEO of Cooey Health. What we do is we have a AI-enabled patient-centric care management platform, pretty holistic platform where we run multiple modules. Some of them include remote patient monitoring, chronic care management, behavioral health intervention, principal care management. Those are a few examples of where people need care away from the doctor, whether they're in their homes or any other facilities. And that's what we provide. So we watch their vitals 24/7, and then we are providing care coaching as and when needed in terms of interventions to help them improve their health. A lot of this is preventive in nature in order to make sure that you don't really take care of people only after they fall sick, but even if they have fallen sick, what can you do from a preventive standpoint to improve the quality of their life and probably even extend their life. So that's what we do.
Absolutely. I would like to get more into detail about this because this really interested me. So it is like essentially a patient portal that the patients would have access to and then the healthcare providers. Is this somewhere where they will be able to check like all the vitals like you said 24/7 so they have access and you said it's remote so that way they wouldn't technically have to go into the office with a healthcare provider. Talk to me about how this
That's
eases.
true.
Yeah.
So, people go, the traditional medicine that we know is people set up appointments with physicians, you show up, you get diagnosed, you get prescribed, you go back home. That's how medicine is done traditionally. Now, what we are trying to do is add on to that so that where people need care while they're at their homes. So, for instance, if someone has diabetes or hypertension, or let's say some kind of a kidney disease, they have these conditions. Their blood pressure needs to be monitored constantly, their blood sugar needs to be monitored constantly. And if it's going beyond thresholds, they need to be alerted, their physicians need to be alerted. They need care coaches to intervene in order to tell them how to manage their conditions. And that's what we do with the platform. We provide devices as well where they're able to measure their vitals. So, yes, on the one side, physicians have access to the data. On the other side, patients have access to the data so they can all correlate to what's happening. And then they're able to actually perform their jobs better as physicians, and patients are able to take care of their health better. So, there's the portal, like you talked about. There's also mobile applications specifically for patients as well as physicians.
That is amazing. I love that. Can you talk to me about how you started with this idea or why you thought there was like maybe like a niche for this or like a gap that healthcare
Sure.
providers needed?
So I've kind of been my own career has been in the healthcare space for the last 24 plus years. And I've kind of started my career learning what healthcare is all about, what insurance plans are all about, and so on. And then over a period of time, I kind of graduated into really looking at the system side of it, and then have spent time looking at the actual healthcare delivery side of it, where people are getting care where they are when they need it. And what I've seen is there's a huge disparity between what we have created in terms of systems versus what people actually receive. See, when someone is sick, they don't care about all the bells and whistles that technology can provide. All they care about is, am I getting the right kind of care, and am I getting it now when I need it? That's all people care about. And so they want it to be simple. At the same time, if you look at a physician, they care about, how do I maximize my time providing quality care to my patients, than sitting and reviewing notes or writing notes or entering it into systems and all of that. So that's what we're trying to bridge the gap in terms of bringing in the technology to help each of these actors do what they do best. So and the way this came about is actually a couple of my friends started the company way back in 2020 with the same premise of, how do we met out care to people where and when they need it, and in the most simplest form. That's how it started. I kind of joined them later. I was actually involved with the company way back, going several years ago, with the people that were actually building it. And it just seemed the right thing at the right time. And that's how I got involved.
Wow. And can I also have a background on yourself and like how you got started with all of this or were you doing something else before?
Sure. I'm from India. I'm an immigrant citizen, and I was actually into direct marketing when I began my career,
Okay, very
right out of
nice.
grad school in India, and then I came to the U.S. Basically to get a master's, an MBA in information systems and e-commerce. That was the time when technology was really starting to just blossom back in India, and I was one of those guys who graduated from grad school before technology hit our schools back in India. So it was important for me to get that grounded education. That's how I came here to do that. And then I just happened to fall into benefits and benefits administration, and from there graduated into healthcare and so on and so forth. And then kind of saw the journey of healthcare with Obamacare kind of becoming law, being able to build insurance marketplaces both for the government and the commercial side. And then one thing led to the other as I kind of moved in my career to get to where I am today.
Very nice. I love that. And now you said you have a background in marketing. I'd like to know if you're maybe implementing anything that you've learned from those times into what you're doing right now and how you're using
Sure.
marketing.
So, one of the things that I had learned way back when I was doing direct marketing was we were taught a 2 minute pitch, how to close a sale in 2 minutes, right? We were selling books, consumer durables, kitchenware, toys, these kinds of things door to door. So there was a very specific way of pitching someone for a sale and try to close it in 2 minutes. And I think whether the sales cycle is long or short, that still holds today. That was one. The second thing that we were taught that I had learned and that I still carry today is the law of averages, which was basically if you go and knock, let's say about 300 doors, you're bound to get 30 yeses. That's what we were taught. So roughly around 10% or so in terms of the success ratio. So you got to get through your nose before you get to your yeses, right? The
Yeah,
moment you step into somebody's office and try to sell, it's not going to be a yes. So, but you got to be prepared for that. A lot of people are not prepared for that because they don't learn it that way. They expect that I walk in and it'll happen. That it doesn't happen. So that's something that I learned that I still carry today. And then, in terms of sales cycles, when you talk about larger deals, government side, it's longer sales cycles versus on the commercial side, whether it's mid-sized deals or smaller deals, you can really close them pretty quickly. And that's what I actually try to teach our salespeople even today. How do you go in and make it a true call sale? One is education. A lot of people don't know about the things that I'm talking about. Remote patient monitoring in the US kind of really started coming into existence around 2015 or so. It still had about 10 years to catch up. This would be next year would be the year when it really would enter mainstream, but that the pandemic that we had accelerated it. People started having a need for it and acceptance for it, and then it just happened that they accepted it. That accelerated the path.
yeah,
So we are where we are today because of that. And now, for a lot of people, even providers included, it's an education thing. You have to teach them and tell them what it is. And once they understand it, the next call is closing the deal.
absolutely. Well, thank you. I'd also like to know, like, just in case some listeners are wondering, are you using social media as anything for marketing as well? Like
Absolutely.
Instagram, Facebook? Talk to me about that.
Sure. We do a lot on LinkedIn and X. We do use quite a bit of that. Now you also got to look at where your target customers are. For instance, a lot of people that we deal with are physicians or providers, and they don't spend a lot of time on social platforms as such. It's a good way to find their information, but not so much as to engage with them.
Mm.
So, a lot of them are still old school in terms of you got to pick up the phone and talk to them or show up in person or maybe send an email out or a letter out. So we do a lot of that. But, as the new age is evolving, there's a lot of new physicians, newly minted physicians that kind of are much more savvy with social media. So that's why we do a lot of that. And then definitely, YouTube videos and Facebook and Instagram, all of that too.
Love that. What have been some of the changes that you have noticed so far in your career um, with any healthcare providers? Like, are they all moving more online? I know, like you said, like some are old school and they like to do
Mhm.
things like shaking hands and talking in person.
Sure. So if you really look at it, right? So, things, you know, it, baby boomers are retiring. There's a lot of those practices being taken up by the new generation of physicians and doctors. They have a different mindset in terms of how they want to manage and run them, because there were people that were born before the internet. There were people that were born at the when internet started birthing as well. Then there were people that were born when social media started coming around, and now we talk about Gen AI. And there are a lot of youngsters who are building Gen AI native kind of companies. So it's all when you were around and what was around you, that's going to influence how you're going to behave as you move forward. So that's what we are seeing with whether it's patients or whether it's providers. Patients, a lot of them are aged. A lot of them are 65 plus or 75 plus, and there's certain ways you can reach them. If I text a 75-year-old, I don't expect them to read it or respond back, versus if I call them and if I I'm lucky to get them on the phone, then it's a different thing. Versus if I send them a letter, there might be better response to what's in the letter. So
Yes.
on and so forth. So you got to look at the age dynamics in order to do that. But you know, there's a lot of new age doctors who are embracing technology very, very quickly. They understand it, they like it, they also see that their influence kind of expands using all of these tools that are made available to them.
Absolutely. And can I ask you, what are your clients mostly looking for when they're coming to you for their services in order to make their jobs more efficient?
Sure. Uh, a lot of them don't really care about the technology, what happens behind the scenes. They care about what can it help them in their job versus how can it help their patients. These are the only two things they're looking at. So if it's a physician, like before coming into this, I was talking to a physician who talked about seeing 30 patients every hour. Okay, that's 2 minutes a patient is what they're giving, right? Now, for someone who's that busy, if you if you say that you got to talk to the patient and then you got to make sure that you summarize that the
Visit,
interaction,
yeah.
you got to write it and then you got to load it into your electronic health record system. That takes quite a bit of time, and that's the honest truth. But there are tools out there that actually record the call while it's going on, summarize it, and give it to you in a text format by the time your call is done. Your job is to just glance through it, approve it, and then it loads itself into the
Wow.
EHR. So that's where we are today from a technology standpoint. And when we talk about this aspect of it, that if you were to spend about 15 to 30 minutes in doing all these actions versus now you're able to do it in probably less than 30 seconds, that's what they care about,
Yeah.
right? And then as far as the members are concerned, so a lot of the physicians that we talk to, and even the members for that matter, when we talk about devices, right? So for instance, one of our programs talks about measuring vitals every other day. So in a 30-day period, you got to have at least 16 vitals that are recorded back into the system,
Wow.
which basically means that the people need to make sure that they're checking their vitals every day. Some people don't, right? So then we have thresholds in terms of saying, okay, if you see consistently 3 days where somebody hasn't checked their vitals,
Mm-hmm.
it's time to get on the phone or however you want to reach them,
Wow.
text them, call them, whatever it is, for the care coach to find out what's going on and to get them back on track, right? Those are the things that we do with our products and systems. Now, the patients love it because they're being nuts. Some of them feel frustrated because if you keep getting that call again and again,
Oh, yeah.
you don't want that. But then you keep telling the person that you got to improve your habits. It's your health, right? So that's what we do. And then on the provider side, they like it because you're making sure that that patient is taken care of and they don't come back to you for the same reason for which you've diagnosed them, or they don't end up in an ER facility or the hospital as a result of not taking care of their health. Because 20% of the patients that we have in the US, they are the ones generating 80% of the costs. So if healthcare expenses are growing, we are right around 4.5 trillion in terms of what is spent in this country for healthcare. But another 2 years we should be at about 6 trillion. That's a lot of
That is a
money
lot.
going in, right? But then if that money is spent for the right reasons, it makes sense. But if 20% of the people, that is, out of all the 330 odd million people that we have in this country, 20% are creating that 80% plus cost, and those 20% are the ones that need that intervention in order to contain those costs. So that's what we're working on.
Oh my goodness, that is like so much to think about. Like, especially for healthcare providers who are so busy and they're looking how can they use their time the most efficiently and can help their clients. That's incredible what technology has been able to accomplish nowadays.
Absolutely.
Right? I would like to ask, are you the only one on your team or do you have a team? How do you work
We
behind the
do have
scenes?
a team. So we kind of distributed between India and here in the US. We have an office in Bangalore in India. Um, so there, what we do is all of our technology team is there, the ones that are building the product, enhancing the product,
Wow.
implementing it, and all. And we do have a presence here where some of the executives are here. There's some executives out there as well, and all the care coaching aspect of it. Whether it's RNs, registered nurses, CNAs, LPNs, social workers. These are the care coaches, the team that we have that interact with the patients on a daily basis, and that's all stationed here in the US. So
Wow.
that's how we divvy it up.
Very nice. Where do you see yourself and your business in the next 5 years? Like, do you hope to expand and reach more people?
Absolutely. So we are in a growth cusp right now. So where we're continuing to grow, we're out there with a lot of physicians nationally. We want to continue to expand on that. We are also with what you call accountable care organizations and federally qualified health centers who are all focused on providing care, but with the idea of what you call value-based care. And value-based care is how do you treat a person as an individual and provide them the care that they need in a wholesome fashion, not for a specific issue, but as a person, and then make sure that their health is being taken care of and that they're not coming back into a doctor's office for the same reason that they have been seen over the last couple of weeks or months. So there are measures that the government is tracking, CMS, Center for Medicaid and Medicare Services, is tracking in terms of saying, if you take care of a patient as a provider, how do you make sure that they don't come back to you for the same reason? This is how you make sure of that. So that's what we're doing, and they incentivize providers to be able to do that. They penalize providers where they're not able to do that. So there's a lot going on in healthcare as we move towards value-based care. There's a lot of focus also on not just managing sickness, but how do we manage people when they're well, so that everything can be prevented, preventive care versus sick care. So that's how we do it today.
Okay, love that. When you're not doing all of this stuff and like managing and taking care of healthcare providers and their clients, what do you like to do to unwind? Because mental health is important not only for
Absolutely.
people but for yourself. How do you like to make sure that you are at your best capacity for your
Sure.
clients?
So the couple of things I do, my passion has been writing. I write and publish quite a bit. And then the other thing is I started a podcast. Plan B Success is the name of it. And I started way back in 2019 when I was between jobs, by the way. And I kind of got introduced to podcasting. I did not know it was there. I learned what it is. And then I thought, there were a lot of 20 somethings doing it at the time. And
Yeah,
like, okay, if they can do it, I can do it better.
that's right.
And that's how I started it. And the focus was primarily on personal growth and professional growth for whoever, wherever they are in their career, whether it's students, entrepreneurs, career professionals, whoever it is.
Yeah.
So I started that. I used to do about 3 episodes a week.
Hmm.
One was an interview, and then every alternate day I would do a solo episode and put it out there. And it was pretty addictive.
Wow.
Once
Okay.
you start doing it, and then kind of expanded it from a podcasting medium to YouTube and so on and so forth. I still continue it today. But that's one way of unwinding. It lets me continue to learn, and not specifically healthcare focused stuff,
Yeah.
but
Other things in
other
life.
things as well. And then what's interesting is this was during the pandemic too, afterwards, right? So it was a way of meeting new people, without really meeting them. So it was all e-meets, it was all over video. But then there was so much to learn from other people and their experiences. So it was great for the listeners. It was great for me interacting with people, and then was able to meet a lot of different people in different areas over a period of time.
Yeah. And I know this might be kind of silly, but it sounds like you are somebody who definitely likes to learn and do things on their own, like starting your own podcast. Some people have trouble with that and they don't even know where to start. And did you just look up stuff on YouTube and figure things out on your own?
Yeah, so it's interesting, right? So there were a lot of people who were teaching it at the time, and I wanted to do it on my own. I said, okay, let me do my research. It was a lot of Google stuff,
Yeah.
googling to figure out what it was about, and what were the free softwares out there. How do you record? How do you edit? I spent hours on it. Basically trying to get good at it. And I think it's the same thing, right? I still remember the very first time I did an assignment on Word. When MS Word was new, I spent 4 hours doing the assignment, and then I shut it down without saving it.
Oh,
Then I spent about 2 hours rewriting it, so the time was lesser.
yeah.
But that was my very first Word document, so
Oh my
I still
goodness.
remember that.
I
So
bet you never did that again. You
no,
saved them all the
never
time.
again, never again. But that's how you learn, right? So podcasting too was like that. Initially when I used to edit, I would spend hours editing a 30-minute bit, right? then you get the hang of it and then you move on. And then at a point in time, I started hiring somebody to do some of that stuff.
I love that. No, I love how like you're so into like what's next and what's changing and you're going with you because a lot of important things that a lot of business owners maybe don't realize is being able to adapt to change and
Right.
learning new things. So I feel like you're definitely somebody who's like, okay, well, this is a new obstacle. Guess what? I'm going to learn it. I'm going to use that to
Absolutely.
help my skills and to help my life and business. So I think that's incredible and I like that you shared that with us.
Absolutely.
Where can people check out your podcast?
It's called Plan B Success. PlanB.live is the website. They can check it out there. It's also on YouTube at Plan B Success, and then all the social media stuff.
Beautiful. And now, is there anything that I have not touched on for your podcast that you would, or your podcast, or for your business that you would like to share with our listeners, whether it's about yourself, your business, anything else, maybe for potential clients that you.
Absolutely. So if you're a physician, no matter who you're seeing, whether you're a general physician or a specialist, yeah, everybody has chronic conditions. Like today I was talking to a nephrologist, and he's concerned about his patients and the ability for them to manage their blood pressure. That could mean whether they live for 2 years versus they extend their life by more years, right? So it is very, very highly impactful. So definitely check out cooeyhealth.com. That's our website, COOEYHEALTH.com. The reason for Cooey is basically a call to attention. That's how we came up with the name. So the idea is to, hey, it's time you take care of your health. So, and we do it. We do it for physicians. It's end-to-end services. If you're a physician, then you don't have to do anything. All you have to do is provide us access to your patient data, and we pick it up from there. We find out who's eligible, who will benefit from it. We reach out, we send the devices, we manage their health, we bill, we collect, and then we share revenues with the physician. So for them, it's like passive income coming in while their members are being taken care of. And then, of course, whether it's payers or others who want to use our services, we're happy to do that. We're also working with, like I said, value-based care programs, where they can do it, where they can use it. And if it's patients listening to this, they could tell their doctor about these programs, and it definitely will benefit them. No cost to the physician, no cost to the patient.
Absolutely. Thank you so much. All right. So I'm going to ask my last question. It's one that I
Sure.
like to ask all of our listeners who come on the podcast. It's, do you have a saying or a quote or maybe a mantra that has inspired you in your life? And would you mind sharing what that quote is?
Absolutely. One of the things I talk about is attention. I think attention is the new currency. That's what I talk about. You got to keep listening. You got to keep looking at what's changing and what's happening in the world. The change is so rapid nowadays that by the time you learn something, there's something new already out there. So you have to pay attention. You got to always be learning and absorbing, and that's how you will move ahead with the times. It's important to move ahead with the times.
You heard it here first, y'all. Well, thank you so much, Rajiv, for coming onto the podcast today and spending time and sharing your knowledge and about your amazing products that you have. I appreciate it so much.
Thank you. Thanks for having me.
Absolutely.